Good morning. I'm here at the One Vision in Watford. Today, we're going to have a special guest with us this morning, and it's Sunday. Um, how wonderful to join with Geoff Brown. And Geoff is the Chief Executive for Healthwatch, Herfordshire. Good morning, Geoff.
Morning, Enoch. Thank you very much.
How are
for
you
inviting
today?
me. I'm good, thank you.
Yeah,
I'm
thank
fine.
you for coming to Watford to join us with the podcast. I see Healthwatch is a big topic, coming out of COVID and the pandemic. Just before we go into that topic, Geoff, could you, I know you have got a very broad background in terms of working with the government and everything. Could you just give little bit about yourself, what you used to do before the Health Watch?
Yeah, happy to do so. So most of my career, I was in local government, and I was in sort of frontline services, libraries, and so on. But then I sort of moved into more corporate roles. And when I worked at the county council, I had sort of responsibility for equalities, for community engagement, and also issues around sort of performance and so on. But I mean, that was great, really, getting out and talking to people in communities and thinking about how we could provide services in a way that reflected people's needs, and also listening to what people wanted. So yeah, so it was nice background to sort of then when I moved away from local government, I worked on my own ran my own business, and then got the opportunity to work for Healthwatch, and we created an organisation that is hopefully focused on the needs of communities and hearing people's voices.
Brilliant. This is around 2013, I believe.
Yeah, that's right.
Brilliant. Yeah. So what made you to create this organization?
Well, there's a sort of health watch in every area. So there's
Yeah.
about 150 health watch in England. But I suppose it appealed to me in two ways. One was the chance of setting up a new organisation. It's quite exciting to do that. But also because I think I've always had a sort of commitment to the NHS, to social care, and a commitment to sort of the patient perspective, community perspective. So it seemed quite a nice way to bring those things together. And quite nice to work for us. I mean, we're a small charity, but it's quite nice to get to know everybody and work in that sort of environment.
Thank you for that. It's very clear, Health Watch, it says what the meaning is. But in your own words, tell us, what is Health Watch?
Okay, so yeah, so I suppose there's three things that we do really. So one is, we want to hear what people's experiences are. So if you go to the dentist or the hospital, or you go, I don't know, to the pharmacy or something, and you have a good experience or a bad experience, it's quite good to tell us what those things were like. So that if it didn't work very well, we can then try and improve something, talk to people to try and get that improved. We offer a signposting service, so people can call us perhaps if they, I don't know, it could be that they want to know something immediate. Is there a support group for this health need in the community? Or it might be something like, I'm not happy with my GP. How do I go about changing GP? Or it could be, someone's not happy again with perhaps the care of a family member at an acute hospital or a mental health service or something. And they can contact us, and either we can tell them how to go about doing that or refer them onwards. And I suppose the third thing is that our role going out into communities and doing particular pieces of work. So we'll do sort of surveys, we'll do focus groups, we'll do interviews to find out what people's concerns are, and just really their understanding of how things are working or not working. So we run a sort of research and engagement program as well.
That's excellent. So, so if somebody is going through something, when, they have to come to you, or, how they can contact you.
So, I mean, most of the contact is either through the phone. We have a phone number for people to contact, and perhaps we could leave the details on the recording. Most people come by phone, or we have an online form, and that's got increasingly used, so people can put their concerns online, and we'll get back to them either by email or by phone, however they want. we at the moment, we're not doing as much face-to-face work with communities, but hopefully we'll be able to do more of that. And also we do get some contact. People write to us, actually write and send a letter, and we can respond to that. So all sorts of different ways. A lot of access is via the website and the forms there. Really.
I'm sure that last 2 years is a tough year for all of us because of the pandemic, and I think we're still going through a big challenge, rightly say. Do you think there are still issues you see people still facing?
Yeah, absolutely. We did some work early on in the pandemic to find out what people's concerns were, and some of those related to people's mental health. That whether it was sort of concerns about the pandemic itself, or they were feeling lonely and isolated, if perhaps if they were shielding or something. And although it's a while since the sort of pandemic kicked off, we know that people's mental health is still a concern. The number of people who need to access services has increased, and people, probably people are more ill around their mental health as well. So that was a concern, an ongoing one. I think, there's people who were waiting for operations and so on 2 years ago. Those waiting lists have grown, so a lot of people are waiting for help, or having help as they're waiting for an operation or something. And then there's some sort of unexpected things. So one of the big issues we've dealt with has been around accessing an NHS dentist. The number of NHS dentists doesn't reflect the need that people have. People find it difficult to get appointments, and even in urgent cases, people are struggling sometimes to get an appointment. So there's the sort of all the stuff around the concerns and what's happened in terms of long COVID and so on, and the disproportionate impact on some communities as with the pandemic, but also some sort of things that have happened because of a lack of access to services during the period.
That's brilliant. Also, the impact on mental health amongst the children and young people during the pandemic is shooted off, especially due with eating disorders and all this. Is that something your Healthwatch looks into it?
Yeah, absolutely. No, that's absolutely right. So, the young person's mental health challenge has been a real challenge, and as you say, specifically eating disorders. So, it's an area that I think people are more aware of it, and so there's more. Hopefully, more support will be available. But we know a lot more young people have had challenges, and a lot of that has been around eating disorders. And it's one of those areas where we got quite a lot of contact from, particularly, I think, from parents or their family members concerned about their young people, and some from the people themselves where their experiences of services haven't been that great. So we've had conversations with the providers of those services to try to, at least put forward about people's experiences and how things can be improved. And there's an openness to hearing that and improving those services. But there's a lot of demand for a relatively small amount of service, I think. So it's something definitely to be concerned about and watching, I think.
So I hear from you, you can change things and improve services. Is there any particular example, or give me some example?
Yeah. So I guess what we have as Healthwatch, as well as the stuff where we're hearing people's voices, we then go to people who provide services and talk through what people have experienced and raise those issues. And we meet with the leaders of the health, leaders in health and social care, to talk through what people's experiences were. So we've got sort of powers to do that, and those organisations are legally required to respond to the issues that we raise. But most of them are quite keen to hear the voices and to put things right. I mentioned earlier about dentistry as a specific example. What we've done there is help people understand what is available if they've got emergency needs, how to go about doing that. Those services are available through 111, but we've talked to 111 because sometimes the people's experience of those services wasn't as great as it might be. But we're also working with the NHS in the region to improve the number of appointments that are available, improve awareness of what services they are. So it's about hearing those things, hearing about people's experiences, but hopefully doing something to help. And on a more sort of immediate basis, one of the nice things of the job is when someone contacts the signposting service and they've got one of these problems like I was talking about earlier, and we can tell them how to go about sorting things out. And we get quite a lot of compliments afterwards where we fix stuff at a very immediate level. Sometimes it might be, one example was when people were housebound and needed to have a vaccination, and that vaccination wasn't happening, and we were able to sort those things out. So it can be quite immediate and practical for an individual, or it can be something bigger within the system, really.
Geoff, you must be very influenced with local government, your organisation, and with NHS leaders. Hearing all these surveys, do you challenge them?
We do. It's not sort of having to go in and bang on a table or something. It's usually more about saying, we've had the concerns raised about this service. This doesn't seem to be working very well. These are the issues about communication that's happening. So we're able to go and challenge them. I think because we're known as an independent organisation, we're known as a voice of patients, and we do it from an evidence point of view. So it's what people have told us about their experience, rather than as just say this isn't any good. If we say this is what happened to people, this service didn't reflect their needs, or people weren't communicated with about this service, they can do. The more specific the things are, the more they can address them. And so I think particularly during the pandemic, when they haven't had their own sort of routes available to talk to communities, they've welcomed what we've been able to say to them. And as I say, they're usually open to it rather than as needing to be formal or exceptionally challenging, perhaps.
Working with the community, Geoff, have you experienced, your organisation experience, people are thinking, nobody listens to me, no one hears our voice? Do you experience that? Do you, how do you work with those people who lost their confidence with?
Yeah, absolutely. Obviously we want to help everybody. We want to hear from everybody, but some people are better at knowing how to raise issues, or they've got contacts to do things. But part of what we do is focusing on people who are either particularly disadvantaged, or their voices are heard less often. There's a few examples of that we've done in sort of the last year or two. One is with the veterans community, with service leavers, where people leaving the armed forces often having significant health needs, but not necessarily having the support from the way that the NHS worked. And so we were able to talk to the veteran community, find out what some of those issues were, and talk to NHS providers who have put things in place to be more understanding of veterans. People with learning disabilities are entitled to a check on an annual basis with their GP, but those don't always happen or aren't always particularly helpful. So we've again talked to the learning disability community, found out about their experience, and those changes have been put in place. So there's monitoring to make sure those appointments happen. One of the things it was important that services moved away from being face-to-face during the pandemic, but for people who couldn't access technology or got concerns about it, they could feel more at disadvantage. Their voice was going to be heard less if they didn't have the routes to follow. And so we've done some case studies with people who felt sort of digitally excluded, about what the reasons were for that, how they could be addressed, and also talk about hopefully more provision being made face-to-face in future. And probably, the biggest issue at the moment, biggest concern we've got is around, we know that the pandemic affected the communities disproportionately, some ethnically diverse communities disproportionately. We know those voices have not been heard. And for some of the people within those communities, and you know these communities very well yourself, but there's a sort of a feeling that they haven't been listened to for a long time. And so it's important, I think, to be going out and hearing about what people's experiences are. but also to explore some of the specific issues. We're looking at the moment around, particularly with the Black, Asian and Arab communities, around whether they feel that the NHS treats them equally to people from white communities. So it's about hearing what their perspectives are, and finding out what their concerns are. And just on that one, perhaps for a moment, so far about half the people we've spoken to don't feel they do get equal treatment. And a strong message back to say about sort of cultural sensitivity in the way that the NHS and works to reflect how communities need services to be provided and how they need, how things reflect that cultural sort of sensitivity. We're also we're having interviews with each of the NHS organisations to check out how they see the issues and how sort of what they've put in place to address those issues around inequality that they know about, but what are they doing to address it? So we've started those interviews. So it'd be interesting to see the outcome of that, really.
Brilliant. Geoff, at One Vision, one of our arm is One Voice, bringing communities together. We are in a kind of doing a research on how we can bring different communities together to understand each other's culture. One thing I want to ask, working with your organization for the last 6-7 months with your team, I still wanted to understand there are different communities, especially during last 10 years, I would say the immigrants is going higher and higher. These different communities, do you think they've experienced struggle in different ways? And, in terms of mental health, and you talked about NHS, how do we meet their needs? How do we ensure that we are meeting their needs?
Yeah, I think you're absolutely right. I think there are very specific needs, very different needs. I suppose there's a baseline of a good quality service and good communication applies to everyone. We've made a start, I think, looking at some particular communities and the needs of those communities, but there's a lot more needs to be done. And as you say, it's not enough listening has probably happened by everyone over recent years. There are a number of initiatives happening, both sort of led by the NHS and the voluntary sector to try to get to as many people from diverse communities as possible to hear those different perspectives. And I think it's your approach to sort of, in a way, to give everybody a chance to be involved, but also sort of do it together rather than it be a completely separate approach with everybody is a good model. But so I think there's a lot still to be done. I think there's some desire to do it at the moment and to get to as many people as can be involved. But I think it needs to be a long-term approach as well. My concern is that at the moment everybody knows about its importance, people are talking about it, there's funding within the NHS and so on to address those inequalities issues, but it needs to be a long-term thing rather than something that's just happened in the light of what people have experienced over the last couple of years.
Great. I've seen your organisation done brilliant work with dementia work. Do you think dementia exists in ethnic minorities' families?
Yeah, absolutely. I think and that it's an example, perhaps, of where the sort of cultural sensitivities come in. We've known, for instance, about how dementia is seen within Gypsy and traveller communities. There are, it's particular challenges, perhaps, in that community. I think it's something where we need to understand more about how things are seen and how we go about supporting people in those situations. So, that might be something we can work with you to get a greater understanding of how we can help without it being an inappropriate approach to take.
I've seen there are a lot of effort put on dementia, whether it's county level or in local government or local councils. And I see families with ethnic minorities, families, especially with South Asian communities, the parents, experiencing dementia, or even the children experiencing autism. And I think, and I personally, as running this organization, one vision and going around and saying, we need to do enough, enough work to reach out to those communities. I'm sure that you will agree with me in terms of I'm grateful that I found your organization working with your team. I'm quite happy to work. I think we still need to reach out to those communities in terms of helping those needs.
Yeah, no, completely. I think that's absolutely right. And I think, if any sort of any advice that you've got for us to make sure we can do that in a good way, we'd be very happy to.
It looks like you're helping people with a big range of issues. Is there any other thing you're working right now in different projects?
There's a few things that we've been working on that are sort of coming to a close. We've been doing work looking at an app for young people with learning disabilities, which is going to have their sort of medical records on, and we've been doing some sort of working co-producing with young people an app to sort of assess its value. We do quite a lot of work around co-production generally. So, for instance, in the west of Hertfordshire, there's a model being developed where the patient and community voice is going to be very much part of working alongside NHS and social care colleagues to develop services that reflect people's needs. So, as a sort of, if a new service is being developed, there's an opportunity for patients and communities to help shape it, rather than it's when it's delivered that they see it. So there's quite a drive to do that. We're involved with what's called a community assembly in the east of the county, which is bringing together voluntary sector people from communities, patients, and the NHS to sort of talk about important issues there. So it's a mixture of sort of projects and opportunities for developing new models, because there's quite a lot of change happening within the NHS at the moment.
Yeah, we strongly believe in working together, make a big impact in our community. Is there any other organization you work with in terms of charities or community groups? Is that throughout the Hertfordshire? Is there anyone you work with very closely?
Lots of them actually.
Okay.
So, but we, I guess it reflects the sort of breadth of our approach really. So, it could, at the moment we're doing quite a lot of work with community groups from particular communities. We do a lot of work with people like Age UK around agendas like the dementia agenda. We work with Hearts Independent Living Service because they do a lot of work going into people's homes and supporting people in communities. We work with community development of Hertfordshire, where sort of umbrella, and with the CD, community development agencies locally, so where they've got roots into smaller groups as well. And then we work with quite a lot of people like Viewpoint that support people with mental health challenges. So I guess quite a few, some of the bigger organisations, bigger charities, but also some sort of very local ones as well.
Brilliant. Thank you so much. Geoff, I understand you're currently working in a project on unequal treatment with health and social care. Could you just talk through us with the current project?
Yeah, absolutely. So I think I mentioned a little bit about it earlier. What we wanted to do was to look at how people felt around access to services, whether people were treated equally, and so on. And our particular focus at the moment is with the Black, Asian, and Arab communities, looking at health inequalities, whether they feel that the NHS treats them equally compared to people from white communities. And we're going out very much and talking to very local groups, often, or individuals, where people have got an important perspective to bring. Sometimes it might be only two people in a small a small organisation that's supporting communities that has a very good idea of some of the challenges that are faced. So I think it's from that piece of work, it's a mixture of hearing about people's experience, whether they think things they're being treated equally, and so far around about half the people we've spoken to don't feel that they're treated equally by the NHS, and we're also talking to the providers of those services to sort of ensure that they're thinking about cultural sensitivity in how they're providing services to a whole range of communities.
So if they do face unequal treatment, what are the protocols to follow? How do they contact you?
If we provide the details for people to contact us, that would be great. They can do it by phone, by email. We're very happy to go and talk to people. I think it's one of these things where probably as a piece of work, people are happy for us to go out and talk to them rather than, anything, a formal meeting or, just ringing us up. So we're very happy to go out, if people make contact with us directly, or, if there are contacts that you have, that come to you, we'd be, very happy to go through that route if that's easier for them. So we want to get as a wider range of voices as we can, but we understand, these very busy people directly providing services often who don't necessarily want to put a lot of time in just to talk to someone, perhaps.
Yeah, I'm sure that people listening to this podcast, we have a little bit understanding about what Healthwatch Herfordshire does, and I'm start learning about this unequal treatment with health and social care, or during this pandemic, reference to vaccination.
Yeah.
There are a big impact on people not taking vaccination, whatever the reason is. Do you see that as a challenge in healthcare?
Yeah, I mean, I think what we wanted to do, we did a piece of work around vaccination, about people's experience of vaccination and their feelings about it. I think it was important to actually hear what people's perspective was. Right, there was quite a lot of noise about what people should be doing or not. And in talking to people about it, obviously from the point of view of a health perspective, you would want to encourage people to have vaccination, and you can see the benefits for people to be vaccinated. But there are also challenges that people had, and some of them might be cultural sensitivities. Some of it might be just very practical things. So some people that we spoke to perhaps had an unsympathetic employer. If they'd been ill after the first vaccination, their employer wasn't encouraging them to have a second vaccination. It was like, well, should you be having it because it means you can't come in here and do your job, sort of thing. Or it could be, when the vaccinations first started, where those locations were not always convenient for people. There was a cost of travelling. There was the difficulty of managing the travel, as well as perhaps care and responsibilities and so on. And our sort of feedback, I think, helped prompt the move for more vaccination to happen within communities. So we would encourage people to be vaccinated, but it's really important to understand the challenges people faced and not to be sort of too judgmental about it, I think.
We work with food insecurity amongst the people with low income, or the impact from the COVID-19. Is that anything you think that will impact their mental health and increase of their health just because of the food insecurity?
Well, I think we often sort of don't talk enough about poverty. Poverty is crucial. We know that the impact of the pandemic was much greater on people who had less wealth. I think the impact, we know that there are challenges now more, some of the challenges around employment, around, having enough money really for the very basic things can be a challenge for people. So I think both in terms of the mental health of people struggling in that situation, the issues around whether people are eating well enough, whether people are making sacrifices so some people within the family could eat, which is something you've talked about. So, I think there are both emotional and physical challenges about dealing with poverty, and that we need to address in the work that we do. Again, it's one of those strands that impacts across communities.
There's many organisations in Hertfordshire working like Hearts, Mind Hearts, they're working with mental health. There's lots of organisations working with, I think it's very important that, we come together, organisations like you, we need to look into people, especially this tough time, food insecurity, that we're going into fuel poverty as well now.
Yeah, absolutely.
People are start thinking whether to heat the house or eat. I think working together with their health is very important. Thank you, Geoff, for joining. I just want to, before we come to an end, I think we discuss a lot. Just talk to us the most important message you would like our listeners to take away from this chat this morning. Something is burning that you want to do.
Okay, so I think we're here to help. So if you've had an experience, good or bad, or you've got a query, or we're doing a piece of research or engagement in your community, please come and say. If you say stuff to us, we can help improve things. And if I'm allowed a second thing, just to say that the NHS is struggling, it's under pressure, but it's open. If you need a service, get it. Don't be put off by the challenge of trying to get a service at the moment. Seek help if you need it.
Thank you, Geoff, for joining us this morning. I really appreciate that you come all the way to Watford to talk about Healthwatch. If you're listening today, or if you're listening later on in YouTube, it will be on Spotify as well. You can watch later. But one thing I just want to share with you is Healthwatch Herfordshire doing an absolutely fantastic work, and they've got a great team. Please visit their website, Healthwatch Herfordshire. If you have any concerns with your health or anything to do with health and social care, please be in touch with their team, and they will be more than happy to work with you, whether it's an individual or family or organisation. Thank you again, Geoff, for joining.
Thank you, Enoch. Thank you very much for inviting me.